Pneumonia. Pneumonia is an infection of small air sacs known as alveoli. It usually occurs due to microbial aspiration or due to an invasion from a nearby site of infection. This is seen in some trauma or lung cancer, since this would make breathing much more difficult, thus decreasing tidal volume and suppressing cough. This would in turn allow organisms to grow. Pneumonia can be developed from many microbes. This includes bacteria, viruses, and yes, including the coronavirus, fungi, and parasites. Pneumonia, if unmanaged properly, can become life-threatening and could also become a chronic disease. Some of the offending organisms of bacteria origin includes Streptococcus pneumoniae, methicillin-resistant Staphylococcus aureus, and E. coli. Some of the viral origin include severe acute respiratory syndrome coronavirus 2, also known as COVID-19, influenza, and the syncytial virus. Some of the mycobacterial origin include tuberculosis and Mycoplasma pneumoniae. Some of the fungal origin include Pneumocystis, Cryptococcus, and Aspergillus. Some of the parasitic origin include Ascaris, Schistosoma, and Toxoplasma gondii. Pneumonia is placed into categories which includes community-acquired pneumonia, where people get infected in communities, hospital-acquired pneumonia, where people get infected in hospitals, aspiration pneumonia, where people get infected by the aspiration of large particles such as food, drink, and even vomit, or when people tend to have a decreased level of consciousness, usually in alcoholism and drug abuse, or in certain neurological conditions such as epilepsy or other conditions that cause swallowing difficulty. Obstructive pneumonia occurs when the airway is partially blocked due to aspirating a foreign object or a lung tumor. Some people get pneumonia but have little to no symptoms. This is known as walking pneumonia. Another way of saying you're lucky to walk around with no signs of pneumonia, even though you have it. But patients should always be careful, as this could suddenly cause pleural effusion and may lead to empyema. Risk groups include smokers and people who've had abdominal surgery, since breathing may become painful afterwards, causing the patient to breathe partially, making lung clearing more difficult. This would allow certain bacteria to grow and infect the lungs. Alcoholism, since they are more likely to aspirate their vomit. Immunocompromised people, such as those who have acquired immunodeficiency syndrome or those who are on immunosuppressants, or infants and toddlers, since their immune system may not be fully developed. And people with chronic diseases such as diabetes, heart disease, or chronic obstructive pulmonary disease. Symptoms include cough, chest pain, fever and chills, and shortness of breath. If not managed properly, pneumonia can lead to several complications such as hypoxia, where oxygen level can dangerously drop, acute respiratory distress syndrome, and other lung injuries. Severe hypotension usually occurs in septic shock, when the offending organism infects the blood. Lung abscess and empyema can also develop in severe cases. Getting the recommended vaccines, such as the influenza vaccine, is by far the best preventative measure. Also combine that with staying away from tobacco, washing and sanitizing hands frequently. Diagnosis is made based on the presentation of symptoms and lung auscultation, where the doctor looks for sounds consistent with pneumonia. A chest X-ray will give an overall view about the condition of the lungs. A CT scan is definitely more accurate in locating the infected site, but the most accurate diagnosis is made through sputum analysis, where the organism will be identified and the patient will be treated accordingly. Treatment include, in cases of bacterial infections, antibiotics such as amoxicillin clavulanate or azithromycin are given. In some cases of viral infections, antivirals such as acyclovir or interferons are given. But do keep in mind that viral and bacterial infections are the most common in pneumonia. In case of a fungal infection, give antifungals such as fluconazole or itraconazole. In rare cases, if parasitic pneumonia occur, give antiparasitic agents such as praziquantel or triclabendazole. Do not forget supportive treatment to control the symptoms, acetaminophen or ibuprofen to control pain and fever, along with plenty of fluids.